Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about a condition that probably many of you have, but don't really know exactly what it is or even what the technical name for this condition is. The name of the condition is something called Predislocation Syndrome, which is actually a concept that we haven't really had for a long period of time. It's a relatively new concept in a multitude of different conditions that are causing a problem with pain that develops at the base of the second toe, right where it meets the foot. That joint that's underneath there is called the metatarsophalangeal joint. And essentially, by looking at a model, here you have the second toe. This joint that's right here is called the metatarsophalangeal joint, and in the ball of the foot, a lot of times people can develop a rather painful condition in which there's swelling, there's extreme pain to pressure either by pushing on it or walking, and there's also can be warmth too as well. This condition is a little bit more dramatic than other types of pain in the ball of the foot because of a couple different factors. You can get inflammation in all these joints underneath here just by simply having too much pressure on it because your feet are too flat or you have too high of an arch, and that creates too much pressure. However, in this particular joint, what can happen is something that's a little bit more substantial. As is common in this condition, a lot of people who have it will have basically a small hammer toe in which the second toe will start to contract upward a little bit like this, and the rest of the toe will kind of curl in this direction. Now, as that process increases and pressure increases to the ball of the foot, there can develop a slight amount of damage that can occur in the tissue that basically envelopes this joint right here. And as that inflammation increases and that sort of slight tissue damage increases, this tissue will start to weaken. Now there's a thick structure on the bottom of here which comprises a multitude of different types of tissue, from ligament as well as other connective tissue that kind of holds this joint together, and that's called the plantar plate. That particular bit of tissue, when there's starting to become increased pressure either from too much pressure on the bottom, usually because of flat feet, combined with the pressure of as this toe is increasingly becoming contracted and then subsequently pushing down on this bone will begin to start to have too much pressure against this plantar plate and will cause some of those fibers to start to separate. And as that plantar plate basically starts to kind of split open essentially, this bone right here, this second metatarsal, will actually begin to push down through it, and the toe will become even more contracted, sometimes to the point, and often to the point, where it actually becomes unstable and it rides on top of this bone because the plate that holds it down is torn and it's no longer as viable and as strong as it used to be. The result of this condition is a significant amount of inflammation at this joint, which includes a lot of swelling, a lot of pain to direct pressure, usually to pressure when you push kind of right at the base of the toe on the bottom here, as well as warmth and even redness can develop as a result of that. Now, other conditions can cause the same types of pain, including fractures at this site, specific inflammation regarding joints from diseases that cause arthritis and things like that. But by far and away, the more common cause of a very specific amount of inflammation and pain in this area is usually due to this predislocation syndrome. Well, how do we treat it? Well, essentially, several things have to take place. You have to support and maintain the foot structure and decrease this massive amount of pressure that's going on to the joint. That's a little bit easier said than done. Certainly any problem with the foot structure, such as flatness of the foot, needs to be controlled with an orthotic device, which will therefore reduce the pressure across the ball of the foot and help to improve and decrease that tissue damage. Another technique that can be used is a taping technique, in which the toe is kind of taped down at this area so it's no longer allowed to ride up and over this joint to push it down as you walk. Unfortunately, when you start to develop this condition and it gets into full swing, these measures often aren't really that effective. Things like anti-inflammatory medication can also be taken to reduce the inflammation. We don't typically tend to suggest injections in this joint because the steroid material can actually weaken that plantar plate even further, causing it to rupture more. Usually what has to happen when we treat this condition is we've got to go in surgically and provide some level of repair. Now, a lot of times The main problem with why there's increased pressure to this particular joint on the bottom altogether is that either this bone is pointed too far downward in angle, or maybe comparatively speaking, this bone, the second metatarsal, is actually too long, and so this joint is basically getting compressed too much and it has to go downward in order to act against that compression. So oftentimes surgery is needed to fix this, and what we typically tend to do surgically is we decompress this joint by allowing or making some cuts in this bone to allow the bone to slide not only backwards but also upwards too as well, to reduce the pressure on the bottom. The toe itself, the hammer toe that's formed usually initially before this process, also has to be corrected, because you have to reduce the contraction of the toe and straighten it back out so it's no longer causing a downward force onto this bone as well. A lot of people will also go in and try to find the tearing that goes on in that plate itself. Other surgeons choose not to, because oftentimes the dissection needed to go through and find the torn plantar plate and to put a few stitches in it to repair it usually causes more damage and scar tissue. So it's just a surgeon preference as to whether it's repaired or not. If it's not repaired surgically, it still heals together once that pressure is relieved off of it from the overlying bone, and it does fine on its own. So it's really just a surgeon preference whether or not they want to actually go in and physically find this splitting in the tissue and repair it. But generally, surgery is very successful for treating this, and is usually far more successful than other conservative measures. But there are other conservative measures that are available for treatment. But this is a very common condition. Lots of people have it, and now you kind of know the name of it. Well, I hope you enjoyed watching this video. If you have any more questions on this video or other topics related to foot and ankle issues, you may look at this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you. Hope you enjoyed this video. Please look for more videos on all things foot and ankle on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.